Helicobacter pylori. You might have heard of it. You might have undergone an endoscopy, or you might have a family member or friend who has, and their results showed a positive Helicobacter pylori. What is Helicobacter? What concerns do we need to have regarding it? That's what I'm going to talk to you about in this video. So stay tuned because we're diving straight into the topic. I'm Carlo Cunha, a family doctor, and this is my health pill for today. Helicobacter pylori is a bacterium with a very distinctive characteristic. It's not just any bacterium, it's a bacterium that lives in our stomach and in the first portion of the small intestine, the duodenum. To give you an idea, there are estimates that more than 50%, yes, more than half of the global population, have their stomachs colonized by this bacterium. A few years ago, I myself participated as a researcher in a study we conducted at the Hospital de Clínicas de Porto Alegre, which revolved around this subject of Helicobacter pylori. Our study showed a prevalence of the bacterium in approximately 65% of the individuals studied, practically 2/3. Helicobacter pylori has the ability to survive in the stomach, one of the most rugged, harsh, and inhospitable parts of our body. A significant portion of digestion occurs in the stomach. The environment is extremely acidic, and this acidity exists precisely to protect our body against bacteria that come along with our food. Most bacteria die in the stomach's acidity, but Helicobacter pylori doesn't. That's why I told you that Helicobacter pylori isn't just any bacterium. Over thousands of years, it has managed to adapt to this acidic environment. It does this primarily in two ways. First, it produces substances that neutralize the acidity, which allows it to move more effectively and attach to the stomach's mucosa. This is the second defense mechanism. Helicobacter pylori resides in the mucosa, beneath the mucus layer, where the acidity is lower, providing protection. You might be wondering, how do I get it? Or if you've already tested positive, how did I get Helicobacter pylori? Let me tell you, the primary modes of transmission for this bacterium are person-to-person contact. Direct person-to-person transmission is the most common way Helicobacter pylori spreads. Areas with inadequate sanitation, where water and food might be contaminated with the bacterium. A person consumes this water or food, hence the importance of food hygiene, especially for salads, fruits, and vegetables, which we often consume raw. They need to be thoroughly washed. Personal hygiene is crucial too. Not washing hands after using the restroom can increase the risk of bacterial transmission. Now, let me tell you about the symptoms and the kind of issues Helicobacter pylori can cause in a person's stomach. You already know that it infiltrates, penetrates the mucosa, the innermost layer lining the stomach. When it does this, it starts irritating the stomach cells, leaving the stomach wall unprotected against its own acidity. This can lead to gastritis, an inflammation of the gastric mucosa. It can also cause stomach or duodenal ulcers. Now there's a sore on the organ's wall, you know when you have a canker sore in your mouth. An ulcer is like a big canker sore, but on the inside of the stomach wall. And those who have had canker sores in the mouth know how painful it can be. Imagine that in the stomach with all that acidity. Additionally, there's an association, a higher risk of stomach cancer and stomach lymphoma linked to Helicobacter pylori, especially if the person has a positive Helicobacter pylori result along with an ulcer. In most cases, the symptoms are related to the changes the bacterium induces in the stomach. Helicobacter itself doesn't cause symptoms. People will experience symptoms because of gastritis or some ulcer. The most common symptoms in these cases are pain, a burning sensation in the upper abdomen, around what doctors call the epigastric area. A person might experience a feeling of fullness right after a meal, like a bloating in the stomach. There could also be early satiety, feeling full shortly after consuming a small amount of food. They barely take a bite, and they're already full. When there's an ulcer in both the stomach and the duodenum, there could be nausea and vomiting, hematemesis, vomiting with the presence of blood, dark and strong-smelling stools, and even anemia might show up in a blood test. To keep it from getting too lengthy, I'll stop this video here. This was part 1. I talked about what it is, how it's transmitted, what it causes, and the symptoms of Helicobacter pylori. In part 2, I'll discuss how the infection is diagnosed, the relationship between Helicobacter pylori and stomach cancer, and I'll also explain the treatment. So, if you're not subscribed to Doctor for Life yet, take the opportunity to do so now. Just click the button down below and hit the bell to receive notifications whenever a new video is out. And don't forget to give it a thumbs up, that really helps me out. I'll see you in part 2 of the Helicobacter pylori video. The link is right here on the side, just click on the screen. I'm Carlo Cunha, a family doctor, and that was my health pill for today.